Hello and welcome, everyone. We have with us Susheel Umesh, Chief Commercial Officer, Emerging Markets for Biocon Biologics. We are here to discuss the current dynamics of insulins in India. We know big development has happened where Novo Nordisk has made it public that they will be phasing out a part of their insulin portfolio, the pen-filled versions of human mixtard. That itself is a very significant market. And we'll have Susheel Umesh to discuss exactly what it means, the implications, and the future landscape of the insulin market in India. So thank you so much, Susheel, for joining us for this very important conversation.
My pleasure, Vikas. Nice to be here
Thank
with you.
Absolutely. And it's been a very long time that we are actually discussing.
Yes.
So opening remarks from you, we have heard from several people about how it will really encourage a lot of domestic players to fill in the space that will be left open by the pen-filled versions of human mixtard. And then from there, we can take it to the next level.
Thanks, Vikas. As you are aware, the Biocon story with insulin is a pretty old story. It starts with a vision by Dr. Kiran Majumdar-Shaw to make insulins accessible and affordable to patients of India. And we started with this, and we have our insulins in the market for the past many years under the brand name Insugen and Bezalog Glargine. We are supplying insulins to different countries in the world, more than 120 countries. We are the number 4 global player of insulins today. And in India, we are the largest insulin manufacturers, the Indian manufacturers of insulins. So yes, this development of Novo is well tracked with us. Our partners in India is Eris Pharma. And along with Eris Pharma, we are looking at the developments very closely. But we want to give an assurance to the diabetic patients of India. And that's the purpose why we began insulins in India, from India, that nobody will be denied insulins in India. And this gap that will come up, we are there with Insugen to fill in this gap. So that's one of the confidence we wanted to give the diabetic patients and the doctors who treat diabetic patients in India.
Right. Okay. So yeah, that's a very encouraging statement that there will be enough and sufficient Insugen and other Indian brands that will be there to cater to the requirements. So it wouldn't be a very dire situation where there will be a shortage of supplies. Now, having said that, Mixtard has had a enormous presence in India. And for some reasons, the domestic companies have not been able to garner that kind of a market share that we can actually look for. So Feb data I'm having Insugen 86 crore against Mixtard, which was somewhere around, I think, 776 crore. How do you think that gap has actually remained so big, and what changes will be required now?
One of the things that we've got to admit, Vikas, and we have been in this market in this business for too long, there was some good work done by Novo initially on insulins. And with Mixtard, it's anyhow under price control, so there's not too much of price difference out here with the different insulins. They were well entrenched with the doctors, and especially in markets like the tier 2 markets of India, their presence was pretty strong. So when companies came in with the promotion that we had, we couldn't make that kind of inroads into insulins, and we put generally it's human insulins. Mixtard is the largest component. It's a pre-mixed insulin in the insulin segment in the human insulin category.
Right.
Saying that, we have been successful in many other countries of the world with Insugen. In some of the countries of the world, the Biocon insulin has got a 90% and above market share as well. But here, Novo has been quite strong in this country, and we must give them credit for what they have done. And what we managed was a 10, 11, 12% market share.
Yeah.
Does it mean that the country will not have insulins if Novo is not there? The answer is no. We'll be there to fill in this gap, and we can do it with a little bit of planning and arbitrage of supplies. But
Right.
Biocon will always give priority to our home country. The ambition of Biocon was 1 in 5 patients. And roughly translating, it means 20% of the world demand we can take care of. So that's the kind of confidence which doctors must have in this product. In
Absolutely.
terms of the quality of the product, there's no issue at all. We have been here for many, many years. And over the years, we have supplied the world with insulin. So we are
Absolutely.
quite confident we can fill in this gap, Vikas.
The whole human mixtard as a bouquet of many versions, the pen-filled ones, the vials ones. So vials will stay for even human mixtard, but the pen-filled ones is where we are going to see a lot of shuffle and churn happening. On that front, how is Biocon and Eris prepared? Because the backbone of suppliers to Eris is Biocon. So some word on that.
Yeah, sure. First of all, just a brief about these pen fills. So we are talking about devices in which the insulin can be injected to the patient in a more comfortable way.
Right.
And besides the vial and syringe, the pen was supposed to be the most comfortable way of injecting, which is a good thing to do.
Yes.
So we are very confident. You call it, Novo calls it pen fills, we call it cartridges. So the
Yes.
cartridges get filled into a reusable pen. And we
Right.
are very much present with the cartridges and the reusable pen as well.
Right.
So it does not matter whether
Hmm.
it is cartridges for the reusable pen
Yeah.
or the disposable pen
Hmm.
or the vials and syringes. We are
Right.
there with all these SKUs. So no issue at all.
Wonderful. One more thing that I have actually observed while speaking to a number of doctors is that, when you talk about some other products, about a Indian brand versus a global brand, there is some hesitation whether the switch will be happening. But in this situation, across the board, we spoke to doctors. They say there is no issues of quality. I think that's a very big positive for domestic manufacturing, company. How has that been a plus point? Do you think that probably will be able to accelerate your, ambitions of filling up that space?
Surely. Here we would stand a little apart from other companies because if you know that our Semglee, which is Glargine in the
Right.
US,
Yes.
was the first insulin to get the interchangeability status.
Right.
That means it could be interchanged with Lantus. And that came about because of a lot of science and studies behind this product. So
Right.
these products are well studied, well documented, and there
Yeah.
is been no issue with the quality or anything of that sort.
Right.
The efficacy has been well established in different countries of the world.
Right.
So I think that we stand a very good chance of filling in this space and gap that will be there. And I
Right.
hope that the doctors will write Insugen promoted by Eris now with that kind of confidence because it's got the Biocon mark behind it.
Sure. Absolutely. I am hearing around 500, 550 crore market that probably will be open to other companies because of this big void. Will you really require some additional investments to ramp up your capacities? Do you think your supply chain will need some boost? How will the ground reality change from here?
Because this is, I know you're asking this question specifically for India,
Yes.
but as a domestic company who is in global markets as well, so we are a global company with insulins with that respect. The demand for insulins is going up in the world. And we have anticipated this, and we already invested more than $250 million in our Malaysia plant to double our capacities. So that work is already on. So that's why the confidence that we'll be able to supply.
Right. And by when do you think that will go full commercial on stream?
The DP line, or what we call the drug product line, the finished product line, is
Right.
already up and running.
Okay.
The drug substance additional capacities that we are
Yes.
building
Hmm.
should come in by somewhere mid 27 or so. So
Okay.
that's the timeline that we have. So we are
Sure.
quite geared up to supply.
Right. So far as Penfill is concerned, you are already having sufficient capacities to cater to the additional requirements.
Yes, we'll have to make some kind of supply arbitrage. And one point I must make, Vikas, that unlike small molecules,
Hmm.
insulin needs some time from forecast to supply. It takes, 4 months time before you build up and ramp up. That kind of time is required for these kind of molecules. And that is why working with our marketing partners
Okay.
becomes very important to get the right
Okay.
kind of forecast. So
Okay.
we can make the appropriate arbitrage between analogs and RHI and the different SKUs of, premixes of the rapid insulin and the
Right.
NPH versions.
Right.
So a little bit of time is required more than small molecules with
Sure.
insulin to ramp
Right.
up.
Right. In fact, if I have seen the order and remember right about the Novo notification to the doctors, I think they have given about 6 months time.
Yeah, and that
So
should be enough, I guess, for us to ramp
perfect.
up.
Right. Okay. So staying with insulin, do you think there could be a possibility of switching patients to the analog versions? Do you think that probably also may be another angle to look at? Okay.
Sure. I mean, this is something on the basal bolus concept that has been worked on for years.
Exactly.
So I always compare insulin usage. You are giving an hormone from outside.
Hmm.
You cannot mimic the body. You always end up giving it at the wrong place, wrong time, wrong dose. So in that, how can the life of the patient be better? The best
Right.
way is to do a basal insulin on
Right.
top with a bolus insulin. A
Right.
premix is a good compromise towards it.
Okay.
But a premixed insulin is like a ready-made trouser. You
Yes.
sometimes get the waist right, and
Yes.
sometimes you get your length right. So
Correct.
the best way would be to move into a basal bolus concept that is scientifically well established.
Right.
But then again, it means training the patient. It means that number of pricks which go up more for a patient, etc., etc.
Hmm.
So I always say first start off on insulin. The patient should get some insulin to start off with.
Right.
And once he gets on to insulin, his dose can be toggled and made more appropriate. And there
Right.
are there are shifts always possible to the analog insulins. So
Absolutely.
instead of a premix insulin, you start with a glargine and with
Hmm.
an aspart over it, or a lispro over it, or whatever insulin. Uh, and that will be a good shift to be made. So I
All right.
guess that can be the movement that happens also. But again, to come back to
Hmm.
human insulin also has been there for years together.
Yes.
Though it has been going down, the decrease has been slight.
Right.
Uh, so there are lots of patients and doctors who still
Hmm.
prefer to start off with human insulins. So yes, shift is possible. It will take time for it to happen from a pre-mixed insulin to a basal bolus. And the
Right.
basal bolus is the right way to do it in the end.
Perfect. Right. Since you also have the wider portfolio going beyond India, all of emerging markets for Biocon Biologics, and Novo's plan is also on a global scale. The idea of phasing out some of its versions. Do you think that opportunity also extends beyond India, and how much that will be? Any assessments that you can share?
We have made assessments too early to actually put a finger on the actual tonnage required. But we have anticipated this kind of movement, and we are
Okay.
gearing up on the back end towards it. So
Okay.
we know what will happen, what could possibly happen in this particular area. Yes, the
Right.
demand for insulins is going to go up,
Right.
uh, and there will be a change in the pie structure of the
Hmm.
various players in this. And I
Hmm.
believe that companies like ours, Biocon,
Hmm.
will play a huge role in that as well.
So which will be the other big markets that you may want to explore and have your registrations? I think it will be a bunch of countries, right?
No, we have already registered in more than
Right.
120 countries in the world.
Yeah.
So we have
Right.
been there with insulins for a long time, no?
Yeah. Yeah.
So
No, I'm saying
like
vis-a-vis what Novo Nordisk is going to do for
no,
their
we have got our cartridges approved in all these countries.
right.
So
Okay.
so we have already got our cartridges. We have got a significant share in many
Hmm.
countries. I mentioned about Mexico, where
Right.
we have a partner with
Oh
whom
yeah.
we are working. And
Hmm.
in that country, we have 90% market share.
Yeah.
So
Yeah.
in some other countries, maybe the brand name is not Biocon, but
Yes.
like Intel inside, the insulin inside that is
Yes.
the Biocon
Yes.
insulin. In Malaysia, we are selling as Biocon, and
Hmm.
we have got almost an 80% market share out there.
Okay.
In many
Wow.
countries in sub-Saharan Africa, we do sell our insulins today.
Hmm.
We sell our insulins also in countries like Egypt, in countries like Morocco, with a
Wow.
significant market share.
Interesting.
So we have been there for some time now, Vikas.
Right.
So
Yeah, I
we
remember
are the fourth
Mexico
player.
has been, yeah,
We are the fourth player of insulin in the world.
world. Absolutely. No, I clearly remember Mexico was one of your earliest successes.
Yes.
With, right. Perfect. So I think this is more or less a good wrap up. Any closing statements that you would like to make?
Yes. And I'm making this statement for our patients and doctors in India. We are here as Biocon. We have set up the entire insulins to provide affordable access. India is our home country, and we will sort of ensure that the patients of India will never be deprived for insulins ever.
Right.
So that is the kind of confidence which I want to give your viewers.
Wonderful. Yeah, that's a great statement. And Eris will have a lot more work to do on ground because there is
Yes.
so much of,
We work
you know,
very closely with Eris, and
yeah,
so I mean, we had several discussions with them. We are having some discussions in the future as well. Yes, we work
right,
very closely together.
right. Wonderful. So good to have you, sir. Thank you so much for your time. I think this really is a very important moment for Indian companies on how they fare on insulin. And it's only good that, we have a very robust domestic manufacturing, sector in pharmaceuticals, that sudden decision by a global company doesn't really kind of leave us struggling for future supplies. So thank you so much again and wish you all the best.
Thank you, Vikas. Pleasure to be here.